ThinkWell is an international organization. In some parts of the world, ThinkWell started in 2011. Sometime in 2017, the Strategic Purchasing for Primary Healthcare project had been awarded by the Bill and Melinda Gates Foundation. And the Philippines, happily, was one of the countries selected to receive some parts of the grants together with the other countries.
Essentially, the project is to assist the countries in terms of ensuring that its purchasing for healthcare is strategic. So it's not only about allocating additional resources, but ensuring that these resources influence the behavior of healthcare providers and ensure that this is actually leading to better health outcomes.
Our technical assistance frame has 4 areas, which are policy interpretations, analytics and learning, dialogue, and solutions testing.
One of our main objectives for the strategic purchasing work was to really provide assistance, technical assistance to PhilHealth for it to become a strategic purchaser. The first works of ThinkWell here were really, so to speak, to try and understand the lay of the land for family planning, because that was the original intent. The Bill and Melinda Gates Foundation really have very important emphasis given to family planning. But then realizing that all over the world, it can no longer be just family planning. Then we realized that family planning had to be inserted into what we now call as primary health care. So that's how it started. It was a confluence of opportunities and possibilities working with the DOH and PhilHealth.
In the Philippines, it's not only about giving support to PhilHealth at the national level. It's also ensuring that the DOH is also involved in terms of some of the strategic decision making. At the subnational level, we're able to implement in our 2 sites, Antique and Guimaras, and able to assist them in terms of how they're actually utilizing the fund in the mandate of the Universal Healthcare Law.
In that dialogue, we really tried to link them to all these health sector people, and at the same time, because our strategic purchasing for primary healthcare project is focused on the health financing lens in looking at local health systems integration, we also linked them with accountants, finance people, and even legal people, because we're also looking at policies under the universal healthcare reform.
For the provinces, I think it's that realization that with rigor and with enough time to look at data, you can actually do something. And it's just a matter of helping the provinces see you have what it takes, the resources are there.
Data is very important. All decisions have to be based in terms of good information to ensure that we're actually getting the best outcomes from the resources that we have.
It is not complete. The road ahead is long. But for us, it is to show how local health systems are developed within the rubric of a bigger universal healthcare context.
Our technical experts are really the ones who bombarded information with the team.
As a team, we looked at policies from the national being brought down into the local, talking about universal healthcare integration, province-wide health system. We read all those because we want to give the best kind of technical assistance or knowledge to the provinces that we are partners with.
We help our partner provinces or any support needed by the ThinkWell national team,
giving technical assistance to our partner provinces.
Together with the Provincial Health Office team, we help analyze the data. I sort of think of it as a technology transfer that they are able to do it on their own.
The gains and the achievements that we had for universal healthcare is actually the establishment of the healthcare provider network. That's number 1. And number 2 is the healthcare provider network manual. And we know that this manual has to be regularly updated
Siyempre health kami, siyempre amon nga goal health kit.
Prioritization na hindi lang sa may province mo, sa mga municipalities.
Ang image so gidayang ma-take chance sa bisang health kita. You can do it.
No. Without the support.
Aga kita dahil nga hindi na kita mga liyaw.
We at the PIDOHO would like to strengthen intersectoral collaboration and networking with other stakeholders.
The most significant nga na-gain kang province of Antique towards UHC ay ang personal naman nga touch in the realization of universal health care in the province.
I think ang barrier is ourselves. Navigate natin or ma-clear natin ang path.
Makita nilang less interest or no interest.
All those 18 municipalities, kaon sa ilang mga comfort zone.
Representar na lang kang kada cluster ang nasakop ng municipalities.
Change one thing at a time. And sometimes, given our capacities, even more than that, what if you were the provincial board and you actually had the opportunity to change the entire system?
If all our members of the Provincial Health Board knows what are the latest regulations, what are the latest updates on UHC, they will all be guided on what to do.
Think well, make us feel that we are capable of realizing universal health care.
I'd like to thank Think Well for providing the technical assistance for these two provinces in coming up with their HCPN manual. And we are also proud to say that these two provinces have already achieved more than 70% of the target for the LHSML implementation.
Even if we're not there, the things that we shared with them or the tools and the processes, they will apply, they can still apply.
What I learned from this project is that we deserve quality, affordable and accessible health care.
It makes me happy that even if our project will end, they will be able to sustain what we have taught them and maybe improve upon it.
Let's continue with our journey. This is your story.